partnerships when it comes to dealing with the COVID-19 pandemic. When coronavirus struck our country in March this year, it posed a major challenge to our health sector. And in great stride, the government, under the leadership of His Excellency President Uhuru Kenyatta, quickly moved fast and strategized on how to be able to put in place a response for this deadly virus. As you will recall, many countries around the world, including Kenya, are dealing with the emergence of an unknown disease. And it is clear that this disease can only be defeated by having a whole of society approach, noting therefore the crucial role of partnerships. And to this end, the government has partnered with many stakeholders, including our development partners, who include WHO, who are here today with us, the Clinton Health Access Initiative, UNFPA, UNICEF, the European Union, DFID, USAID, amongst many other partners who have come forward and worked hand in hand with government in the fight against coronavirus. Again, in the spirit of the whole of society approach, we have also held hands with the private sector and regional partners. We've had good collaborations under the EAC umbrella. We've had good collaborations with the interfaith organizations through the Interfaith Council. We've had good collaborations, most particularly with our county governments as we aim to combat COVID-19. These collaborations, fellow Kenyans, are anchored in what is known as the Kenya Partnership and Coordination Framework. This is the framework that the Ministry of Health utilizes when it comes to ensuring that partnerships are effective in service delivery. Ordinarily, achievement of the goal of crushing this pandemic requires mobilization of substantial resources and concerted efforts by all stakeholders in enhancing the quality of healthcare and efficiency. COVID-19 indeed has placed a greater burden on the government, and hence the need to double our efforts when it comes to mobilization of resources, both locally and internationally, in ensuring that we can fight this pandemic. And borrowing the words of the WHO DG Tedros, we can only win this through global solidarity. We can only win this through national solidarity. Now, focusing back on our partnership and coordination framework, it has become important to share with you how exactly we are coordinating the resources that we are getting in, how we are deploying them to ensure that there's rational deployment of these resources. As guided through the framework, we have put in place structures that involve the participation of the Ministry of Health, the Council of Governors, structures that involve the participation of the technical teams at county levels, recognizing the role of the CECs at county level, partnerships that involve actors who are non-state actors, including our development partners, faith-based organizations, as well as implementing partners. The private sector also has not been left behind, including private sector healthcare providers, who all sit and are institutionalized in the structure of the partnership framework. So far, our partnership framework is geared towards mobilizing and targeting resources, ensuring that we are able to, as a collective, agree on priorities when it comes to deployment of these resources, and ensuring that there's a targeted and concerted effort against COVID-19. We continue to encourage these partnerships based on the principles of mutual accountability, benefit, and learning. And these are espoused in the partnership framework that is currently under implementation in the country. And ladies and gentlemen, we are glad today here to be joined by one of those partners. The World Health Organization is here today, represented by the country representative, Dr. Rudy Eggers, and his team. And they're here today to make a donation towards the fight against this pandemic. The donation will consist of several items, including laboratory kits, personal protective equipment, worth about 32.1 million Kenya shillings. And these donations will indeed go a long way in ensuring that we're protecting our healthcare workers, that they're properly geared, and they're able to continue doing the heroic work that they're doing. The Ministry of Health indeed attaches great importance to the welfare of the healthcare workers, particularly during this time of the COVID-19 pandemic. We have received similar donations channeled to us through various partners in the Ministry of Health, and in the spirit of accountability and transparency, we have put in place mechanisms to ensure that each and every donation that comes in within the ministry is actually accounted for and is deployed to areas of need. We have, through the Cabinet Secretary, instituted a donations committee, a committee that is now going to be handling this process, a committee that has a very laid out, elaborate mechanism of how they receive donations, how they're able to conduct quality assurance of all the donations that come in, noting that we want to avoid the case of dumping donations in the country. And then thereafter, they're able to come across a formula of distributing these items. It's a formula that is based on the caseload. So high burden counties, high burden facilities are prioritized. And we do have that here today with you, and we'll be able to share that with you today, particularly for the donations that we're receiving today. And this, therefore, shall be availed going forward in the ministerial website in terms of accountability and transparency. And this is a practice that shall continue going forward. Fellow Kenyans, turning on to our COVID-19 statistics, today we have 679 people who have tested positive out of a sample of 6,590 within the last 24 hours. This now brings our total caseload to 28,104 in the country, with a total cumulative tests of 369,091. From these cases, we have 658 Kenyans, while we have 21 foreigners. 400 are male, whereas 279 are female. And the youngest is a 1-month-old infant, while the oldest is 87. With regards to distribution by counties, as highlighted yesterday and in past briefings, Nairobi continues to lead with 349 cases. Kiambu has 69, Kajiado has 35, Machakos has 25, Nyeri 23, Garissa 18, Mombasa 16, Kericho 14, Uasin-Gishu 13, Nyandarua 13, Tharaka Nithi 11, Laikipia 9, Nakuru, Migori 8, Kisumu 7, Nandi, Busia 6, Meru 5, Muranga, Kirinyaga, Makueni, and Isiolo have 4, Tana River, Trans Nzoia as well having 4, Homa Bay, Embu, Kitui having 3, Kitui, having 2, Vihiga 2, Narok 2, Kilifi 2, Kakamega 1, Baringo, Samburu, Siaya, Bomet, Taita Taveta, and Nyamira all having 1 case. We are delighted to inform you that we have 743 patients who've recovered from this disease, of which 685 are from the home-based care program, whereas 58 were discharged from various facilities. And therefore, our total number of recoveries stands at 14,610, and we continue to extend our sincere, humble gratitude and appreciation to our healthcare workers for this good effort. On a sad note, we've lost 18 patients to the disease within the last 24 hours, bringing our case fatality to 456. And particularly, we would like to announce to you that we have lost an astute health worker who was working at Kemri Medical Research Institute. Mr. Kamau Mugenda was the Director of Corporate Affairs since April 2017, an exemplary worker who will be remembered for human resource development, for automation of the Institute's processes, for implementation of the ERP system, and for infrastructural development. He is to be buried today, and our sincere condolences are extended to families and friends of late Mugenda and all those others who have lost their loved ones. I thank you so much for your attention, and at this juncture, I'd like to introduce the country representative of WHO, Dr. Rudy Eggers. He will give some welcoming remarks, some remarks on the contributions, and then we'll continue on to the session, the question and answer session.
Thank you, Dr. Mercy Mongangi, Chief Administrative Secretary of Health. Good afternoon, ladies and gentlemen. It is now over 6 months ago that WHO declared this a public health emergency of international concern on 30 January, and this was under the international health regulations. This is WHO's highest security alert for health under international law. At that time, maybe you can remember, we had less than 100 cases and no deaths outside China. As of today, more than 20 million cases of COVID-19 have been reported to WHO globally, and over 700,000 lives have been lost. This event has turned out to be the largest health emergency in the world in the past 100 years. In the African region, more than 1 million cases and over 17,000 deaths have been reported. Across the continent, the COVID pandemic has taken varied trends. 10 countries in Africa account for 89% of new cases. However, the lack of adequate testing leads to underreporting of COVID cases and prevents the full understanding of the pandemic in Africa. To meet this demand of test kits in Africa, WHO and other United Nations agencies have formed a global procurement consortium. The WHO-led consortium has secured critical volumes of testing kits and shipped over 1.8 million testing kits to the 47 countries of Africa in the past month. In addition to the direct toll of COVID-19, there have been health impacts that have led to disruption of services on a range of other diseases. For instance, the reduced child attendance in outpatient clinics, the reduced diagnosis of malaria and tuberculosis, cancer screening and care, mental health services. On top of the health impact, of course, we've seen the negative impact of COVID-19 on social, economic and political development. WHO has put forward a number of recommendations for countries to continue to implement to bring this virus under control. As before, and as the Ministry has stated, our recommendations are very clear. Wear a mask at all times when you are in public. This mask should be worn both over the mouth and the nose. Avoid gatherings of people, be it in markets, social or religious events, or personal groups. Keep your distance from other people, staying at least 2 meters away from others, especially in public spaces. Wash your hands frequently and sanitize any objects that you touch frequently, including mobile phones, shopping bags, or items of clothing. We know from studies in Kenya that most people remain susceptible to this virus, even in those areas that have had severe outbreaks. Even in counties where very many people have been affected, there still remains a huge number of people that can contract the disease, that remain vulnerable. So it is not over yet. Over the past few weeks, we've seen in several countries across the world that appeared as though they have passed the epidemic, that now are contending with fresh spikes of cases. We acknowledge that the national government has tough choices to make in turning this epidemic around and to enable the reduction of cases and deaths, even while allowing the economy to recover. It should be clearly stated that these two go hand in hand. The economy can recover fully only if and when we contain this disease. It is clear that leaders at all levels need to step up and work intensively with communities to bring the disease under control. This is to test, isolate and treat patients, to trace and quarantine their contacts, to inform, empower and listen to communities. And then for individuals, keep physical distance, wear a mask, clean your hands regularly and ensure that you cough safely. In addition, we should strengthen the essential health services, improve surveillance, and ensure that those disrupted health services are restarted. Let's keep monitoring in place. because the lifting of restrictions too quickly can lead to resurgence. In recent weeks, we have observed with concern the rising numbers of COVID cases and the scaling up of community transmission in Kenya. We have also seen a general laxity in individuals' behavior from the initial widespread compliance before the opening up of the lockdown locations to where now people are not wearing masks, are not keeping their distance, and are not sustaining hygiene and protective measures. We believe that the rising numbers of transmissions are in part a reflection of this general non-compliance. The response to the pandemic by the government and partners in Kenya has been strong, but there are emerging issues that need urgent and intensified response measured throughout the country. As the disease outbreak develops in Kenya, there is need to ensure that these interventions are made and are implemented. The World Health Organization in Kenya continues to be an integral partner to the government of Kenya during this response and the strengthening of health services. We have been working with the government from the outset of this pandemic and note that the pandemic is now at a critical stage that needs attention and urgency in collaboration. Today, we continue our partnership with the government of Kenya by donating COVID equipment worth 32.1 million Kenya shillings to strengthen the COVID response. The donation is made available from WHO through the funding of our partner, the European Union Eco Fund. The donation contains protective equipment, which includes 250,000 surgical masks, 13,900 N95 respirator masks, more than 5,000 face shields, and more than 4,200 isolation gowns. There's also 10 units of oxygen concentrators in the donation and laboratory test kits, 1,500 kits, and the lab swapping kits, 39,500. These materials will play an important role to make sure that the Kenyan health workers across the country are properly geared and protected in delivery of services. This donation will also boost the effort made by the government in improving the tests of various laboratories in the country. Finally, we urge the Kenyan public to continue to adhere to the guidelines provided by the Ministry of Health and WHO in fighting the pandemic. The fight against COVID pandemic will require collaborative effort between the government, between us partners, and between you, the public. We therefore appeal to every Kenyan to take responsibility in fighting the virus because it has no regard for status or age. Every person that we lose to the virus is a painful experience to the loved ones, and every person we lose is somebody's grandmother or grandfather, is somebody's mother or father, is somebody's sister or brother or cousin or friend. These deaths are not just numbers. They are a mark of pain among families across the country. So let us do our best to stop this pain. Dr. Mangangi, ladies and gentlemen, I thank you for your attention.
Thank you. Thank you very much, Dr. Rudy. We can now have a Q&A session.
Thank you. Good afternoon. My name is Eunice Omolo from NTV. Today you've talked about collaboration and partnership. I'd like to inquire from you where we are as a government in terms of, or as a country, in terms of collaborating in accessing or in studies in regards to vaccines or treatment. Are we in any partnership? Thank you.
Nancy Okware from KBC. My first question is on the fatalities recorded today, 18. How many did not have any pre-existing medical conditions? And do we have any community fatalities out of the figures recorded today? And you've also talked about one infant, 1-month-old infant among the new cases today. What is the state of that infant? Is he or she asymptomatic or in hospital? Thank you.
Fantastic. So thank you to Eunice Omolo for your question. Indeed, today our theme and our presentation is on the partnerships and collaborations that we've had in the fight against COVID-19. And I'm glad that I'm joined here by the country representative of WHO, because they really have a keen bird's eye view of all the different collaborations that are underway when it comes to vaccines. What I can say within the country is that yes, Kenya is on the table. Kenya and South Africa primarily are the two countries in Africa who are frontiers and are looking at different vaccine trials. We have collaborations with the University of Oxford. We have collaborations with DFID and different other partners in terms of ensuring that when this vaccine is found, that Kenya does have a stake in terms of being able to get the vaccine. When it comes to other collaborations, of course, Kenya has participated in different drug trials, and I'll be asking Dr. Rudy to further elaborate on this during his session of the Q&A. Nancy asks on today's 18 fatalities, how many of them had pre-existing conditions? So 15 of them had pre-existing conditions. Only 3 had no known pre-existing conditions. The conditions remain to be hypertension, diabetes. Today it was interesting, I was able to see asthma featuring greatly today, as well as kidney disease. And so that's how it looks like today, about 3 of them having no known conditions. Unfortunately, yes, Nancy, today we did have a home fatality, a death reported from home. This was in Meru, a 55-year-old female who was hypertensive, died at home. With regard to the state of the 1-month-old, I'll ask Dr. Kuria, who leads this work, to expound on that. Let me invite Dr. Rudy to discuss the different vaccine trials that are underway across the world and the role of partnerships in this. Thank you. Rudy, karibu.
Thank you. So in terms of vaccines, WHO has been playing a coordinating role to collaborate with all the vaccine producers across the world, and has been involved in some of the trials directly. 2 or 3 of the vaccines have moved on to the phase 3 trials, which make them part of a large number of testing so that we can determine the efficacy and safety of the vaccines. In all these conversations, there have been collaborations established with the countries, and there have been discussions with Kenya and other African countries to become part of that collaboration. In terms of the therapeutics, the medications that we can give to COVID cases, Kenya is very close to become part of the WHO Solidarity Trial. So this is a trial where more than 70 countries of the world participate in comparing the different treatment modes that are available to us in a global setting, giving certain treatments to certain patients, and by virtue of having a global study on this, we can get information very quickly on if they are effectual or not. So this trial is the approval for this trial is near completion, and as soon as that is completed, then the trials will also start in Kenya. Thank you.
Thank you. Thank you, Dr. Rudy. Dr. Kuria.
I would want to confirm on the status of that maybe before I respond to this one. So maybe as a side chat on this, I need to confirm the status exactly before I respond to that one.
Thank you. So what he's saying is that we'll be able to provide with you details tomorrow on the status after he does his confirmation. So at this juncture, I'd like us to move towards the area of the donations so that we can formally receive them. Thank you.
Pata 50% extra credo bila expiry ya kupiga na ku-SMS across networks. Piga star 444 star scratch card pin hash. Na kama ni M-Pesa star 444 star 2 hash. Safaricom